Hey everyone, Chris here. Today I wanted to talk about a serious subject, the coronavirus. Now, I know that there are goals for a vaccine by the end of December for those who are most at risk for the coronavirus, such as the elderly and people with pre existing conditions. However, it's still an issue. We're not going to be getting the coronavirus vaccine estimates by Pfizer and other vaccine distributors say until early April, and that's months away. There could be many lives that are saved. Now I know a lot of our country, or many people in the U.S., think that the coronavirus is a non-issue or that it is a somehow hoax. And I wanted students leading change. I'm going to have other members be speaking in this video to talk about the coronavirus, offer some different perspectives and new facts so that we can show that we are taking this virus seriously. Now, I know I've been doing my part. I've been staying home and isolating and making sure to wear a mask if I go out on walks and all of these precautions that the CDC and other health advisors recommend. And so my part of the video is going to be explaining just right now the number of cases that we have. So the US has seen over 13 million coronavirus cases total since March. And just the other day, November 27th, we saw 205,000 new cases in a single day. That is around 10 times greater the number of new cases we were seeing in that March, April, May region when we were at 20,000 cases a day, which is huge. I know the second spike got us to 40,000 new cases a day, averaging around that. And that was putting strain on our hospital system. However, with this new spike that we've seen in November, late October and November, it's just put enormous strain. I'm sure you have all heard of carrying capacity and what it means to flatten the curve. And so those relate because carrying capacity is the number of hospital beds that we can actually care for in the United States at one time. And when coronavirus patients start filling up hospital beds, that means that stress is put on the hospital system, and that means that they can't care for as many people as they could have otherwise. And so that leads to more people dying. People who don't even have the coronavirus disease are now dying because they can't get proper treatment that they need in certain regions. I know in Texas, El Paso has been hit especially hard. 47% of their hospital beds are now filled by coronavirus patients, and that's compared to the 11% Texas average. This issue needs to be taken seriously. And the only way we can do that is by continuing to socially distance and mask wear and make sure that we get these cases down so that when a vaccine does come out, we can be successful and defeat this disease. And so I'm going to let some other people speak. Arun's turn is next, so I'll pass it on to him.
Hello everyone, my name is Arun and welcome to this next part of the video. And today I'll be talking about coronavirus and how it's affected minorities. So the first thing I'm going to get away is trying to define the term health disparity. So today health disparity is used to describe how there's a difference in healthcare among specific population groups. So some groups are receiving less quality healthcare than others. That's obviously not ideal. It should be equal healthcare for all. And this is partly due to because of a deeply rooted systemic racism in which society has kind of enforced policies that are meant to uplift people and are meant to be good for the well-being of the communities, but have actually been perpetuating racial discrimination. And so we're seeing racial minority groups feel a great impact of health inequalities in the country, especially during the coronavirus pandemic. So the CDC reported that 21.8% of COVID-19 cases in the U.S. were African Americans, and roughly 34% were Latinx people. So despite the fact that these groups make up only 13% and 18% of the population, respectively. So why is there a disproportionate impact here? Why are more of the cases in the U.S. minorities, but they're only minority in the population? Well, some contributing factors could be a lack of access to good health care, Some racial and ethnic minority groups are underrepresented in socioeconomic status, so they're likely to be uninsured. They can't go to certain hospitals. That way, it could be profession or education and income. Um, more racial and ethnic minority groups are working in essential working environments, and these environments are really not well maintained and they're not suitable. They're not really safe enough. They're safe enough environments to contain a virus, so the likelihood of being exposed to a virus in those areas, in those settings, are much, much higher. And then you have housing where a lot of minorities are living in crowded urban environments, and so it's hard and difficult to follow social distancing and other prevention methods. Next thing I want to get into is coronavirus versus the flu. So some similarities is that they're both can cause respiratory disease, so they have similar symptoms in some cases, and they have a wide range of illness. And secondly, they're both communicable diseases, which means they can be transmitted from person to person through physical contact or through secretory droplets like from coughing or sneezing. But some of the major differences are that the reproductive number for coronavirus, which is the number of infections generated from one initial infection, is 2.5, whereas it's much greater than the 1.3 roughly of the flu. Another major difference is the incubation period for both, the time from the exposure of the virus to appearance of symptoms. For the flu, it's only around 1 to 4 days, but for the coronavirus, it can be anywhere from 2 to 14 days. So an infected person may not even know that they have the virus for up to 2 weeks after being infected with it. So in that time, they could be spreading it to other people unknowingly. Another major difference is that currently the medical preventions for that we have access to, there have been major breakthroughs for coronavirus vaccine with the Pfizer vaccine, of course. However, there's no approved vaccine yet, whereas we have the annual flu shot for the flu and the seasonal flu every year. Next, I want to get into how coronavirus in the U.S. Compares to other countries and how we've responded and how it's going here. So the U.S. currently has the most cases of any country in the world of 13.15 million, and we also have roughly a fifth of all deaths in the world, which is pretty striking. It shows how widespread the coronavirus has been in the U.S. We also have breaking records every single day. We have roughly 200,000 new cases per day of the coronavirus in the U.S. alone. Next highest is 45,000 new cases per day for Turkey. Now, of course, population can be a factor. However, it's pretty striking how we're seeing that many cases per day in the U.S. It shows how widespread it's been, and it shows how important it is to take health guidelines seriously. Like, for example, the Institute of Health Metrics and Evaluation say that if 95% of people wore masks, nearly 130,000 lives could be saved from now until March. That's pretty substantial. Next I want to get into is population density, is a measurement of population per unit of area, of course. But some people like to use it to try and find out how a virus can spread. It is good for that, but it doesn't tell the full story because there are examples of high density cities like Hong Kong and Seoul that have been very successful in handling the virus because they've been able to enforce widespread interventions like mask wearing, social distancing, and contact tracing. So it shows that in those highly populated areas, densely populated areas, I should say, you can control it as long as you enforce the correct health guidelines from experts. So that's what we need to be taken seriously. And that concludes the end of this segment. I want to quickly go over how COVID has affected me, I guess. So past few months obviously pretty terrifying. I have people at home that are at high risk or immunocompromised, so it's always been very I guess scary. But we're getting through it, and I hope everyone else is doing well. Thank you for watching. I hope you enjoy the rest of the video.
Hey guys, it's Haley from Students Leading Change. I'm talking about some topics on the coronavirus. Testing rate. So currently, according to a study done by Johns Hopkins University, there are, as of now, 1,150,184 new tests that have been administered. And right now 9.5% of people are testing positive. So about 125,000 people And then, so the amount of people that have COVID, there's no good source or study that's been done yet because it's too new, but it's projected to be significantly higher than the actual number of people testing positive. And some people aren't getting tested, so of course there's going to be, many unconfirmed cases. And then according to the CDC, the actual incubation period for the virus is 2 to 14 days. But when you contract it, you can spread the virus for up to 2 days before you even show symptoms. So you could not know at all and be, walking around wherever, spreading it and have absolutely no idea you have it. Usually people, after they first show symptoms, they are can spread the virus for at least 10 days. So, and then someone who actually had a really good program to help with the testing, because the testing is not the best at the moment. Bill Gates actually had a program that was sending tests to people's homes, regardless of whether they were sick, healthy, whatever, and having people take tests, and it was actually really helping, detect those people who either hadn't been tested, or just finding those people who were positive and either weren't showing symptoms or they were sick and they just didn't want to get tested, whatever. But it was helping detect those cases, and the whole purpose of it was to keep track of all those cases, just in hopes of getting an idea of just how many people actually have it. Unfortunately, the program was stopped because the FDA said they needed government authorization instead of state. So it's not currently going on right now, but hopefully they get to continue because it's really doing a lot for keeping track of those cases. It's so far the best that anybody has been doing. So, and Bill Gates also mentioned that the testing, the turnaround times were way too long. I mean, I know it's like 3 to 5 days for many testing places, and I mean, if you have to work, or like if you don't have confirmation that you have it and you do have it and you don't know, you could be going to work or wherever and spreading it just because you haven't gotten that confirmation. So he's trying to push for 24 hours to get your test results back, because the 3 to 5 days is just, it's too long. People, if they don't have confirmation, I mean, what's stopping them from going to work? So, or just out. So the need for much faster, more widespread, more efficient testing is drastically needed. Well, those are all my topics. Bye.
Hello, I'm Fernando, representing Students Leading Change. I'm a member of the club, and today I'm going to be talking about vaccine implications related to the coronavirus and masks. So a vaccine is on its way. The Pfizer vaccine was shown 95% effective. The chief executive of Pfizer said, I believe, that it could have 30 to 40 million doses by the end of 2020, so it's all great. But we need to realize that we need 70% of the US population to be vaccinated. So keep in mind anti-vaxxers, and as well as over 300 million people. And also, this is great news, as I said, but don't get too excited, because the vaccine isn't going to wipe out COVID by spring. Social distancing guidelines and wearing masks are still critical, especially at the early stages of vaccination. Why? To protect people who are still not vaccinated yet and help contain the virus. Let's also talk about social distancing. While it sucks, it works. This virus is airborne and spreads even easier when people are close together, laughing, chatting, singing, or laughing. Sure, talking to your friends with Zoom is not obviously the same experience, but at least, hey, you're not contributing to deaths or the spread of the virus. And if you go out with your friends, even if you're young and healthy, you may be invisibly killing someone without knowing it. And I know we're all sick of being stuck inside, but a vaccine is on its way, so stay patient and trust the experts. Masks are also critical because the virus is primarily spread airborne. And by wearing a mask, you're protecting not only yourself but other people. The effectiveness of masks was proved in Kansas, where it was kind of like a little experiment, where the governor of Kansas issued an executive order requiring masks in public spaces in certain counties, but in other counties, there like in the counties that had there were counties that had mask mandates and counties without mask mandates. And unsurprisingly, the counties with mask mandates did a lot better. It said after July 3rd, COVID-19 incidents increased this by the CDC in 24 counties with mask mandates, but continued to increase in 81 counties without mask mandates. So clearly, masks work. Researchers at the University of Washington's Institute for Health Metrics and Evaluation conducted a study, and they said that if 95% of Americans actually wore their masks, 130,000 lives from here till March could be saved. So think of that next time you're considering wearing a mask or not. And I just want to quickly talk about how COVID affected me personally. So I've adjusted to being stuck at home and just try to stay as positive as possible. Staying in touch with people online, with my friends, has kind of kept me sane, and it's pretty much the only thing I can do. I've been trying to go outside to the park, get some air, which has been really beneficial. But it did hit me how deadly this virus is when I lost 2 distant family members. They were in the high-risk group, they were both married, and they both died. My final message to you is to please be careful. Don't just think of yourself, protect the high-risk individuals as well. The elderly are just as human as you and me, and they deserve to live in peace. For now, all we can do is listen to the experts, wear your masks, social distance, and be patient for the vaccine. Thank you.
So, now that you've heard some information that you may or may not have known, what can you do to help? Well, despite what many people think, your actions do make a difference. Your choice on handling COVID-19 could mean a life or death situation for somebody. While some of these precautions may seem difficult and frustrating, with the vaccine just around the corner, you still have to be careful until this virus is under control. I believe that we can get through this together.